In this video, I'm going to demonstrate dry needling to the quadriceps muscle group. So this is really useful for when clients might be suffering from generalized knee pain, or they might have restricted movement around the hip, or they may have suffered a strain injury in the quadriceps, or be suffering from muscular tension as well, which is restricting their movement around the hip. Okay, so with our dry needling techniques, essentially we're palpating for hypertonicity within the tissue and for trigger points. And where we find areas of the tissue that might be tighter than the rest of the tissue around it, or we identify a trigger point which might increase discomfort levels for the client when it's palpated, or it might also send a referral to a different part of the body, maybe coming down towards the knee or up towards the hip. Then we've identified that that would be a trigger point. So we're going to place the needle directly into those areas in order to help to reduce tension within those muscle fibers and possibly to stimulate a twitch response as well. When we see a twitch response, which may represent itself as a ripple through the tissue, we know then that that's led to rapid depolarization within those fibers, which then leads to a relaxation response in the tissue. When the tissue has relaxed, then that will help to increase range of motion around the associated joints, such as the knee or the hip, and it will also help to reduce pain sensation for the client. Okay, so we're going to sterilize the area first. You could use a sterile wipe, or you can use sterile lotion as well, just to clean the skin and also the therapist's hands. Then for the purposes of today, I'm going to use 40mm needles. Our client here, Katie, has got good muscle tone in her quadriceps, so we're going to use a 40mm needle, whereas if I was working with a smaller client that might have less muscle tone, then I would use a smaller needle. So these are the classic plus needles, and as I mentioned, they're 40mm in length times 0.25 in diameter. Okay, these are our guided needles as well. So they're coming in a tube and they have that stopper on the top. So we've identified where that first needle is going to go. So through palpation, I've identified that Katie has a trigger point here. So I'm going to use the perpendicular technique here. So the needle is literally going to go straight down through those muscle fibers. So I've tapped the needle in, or I've pressed the needle in, and then I'm pressing down using my finger and my thumb. I'm pressing down roughly about halfway or slightly further of that needle length. I'm going to place all of my needles in first before I start activating my needles. I'm going to go slightly higher up the rectus femoris muscle here. Sometimes you might find you've got more tension nearer the muscle origins and insertions. And then I'm going to come down here. We can see through Katie's tissue, she's got a little bit of tension, just a bit more laterally. Because the tension is a bit more lateral here, I'm then going to come at a slight angle with my needle as I press that needle in, supporting the needle and then pushing down roughly about halfway. Again, if I found more tension nearer to the knee or more tension medially or into the adductors, I could also place a couple more needles into the adductor group or into that vastus medialis as well. So once my needles are in, then from here, based on the feedback from the client, we then might start our activation. So our light activation methods are our flicking of the needle. As we flick the needle, as we can see here, that then sends a vibration down through the needle and into the tissue. We can also turn the needle. This helps to wrap the fascia up around the needle that's inside the tissue, and that again can lead to an increase in sensation for the client. And if these lighter activation methods weren't stimulating a twitch response or any sensation to the client, we could then pepper the needle. So when we're peppering, we're lifting the needle up to about the tip of the needle. It's still inside the skin. And then we're pressing down roughly about halfway to 3/4 of the length of the needle. We'll do that about 3 to 4 times before resting the needle. And sometimes it takes a little bit of time for the sensation to appear. And then whilst these needles were in, we might, after we've activated them, leave them in order to activate the tissue and to create that relaxation response and to increase that blood flow. Whilst the needles are staying in, we then might move over onto the other limb, and we could do other techniques such as manual massage or dry needling or dry cupping to the other limb. So we're treating both sides of the body at the same time with a variety of modalities. So in this demonstration, I've shown dry needling to the quadriceps group using 3 needles here, and they're 40 millimeters in length. And we've activated the needles using the flicking technique, using the turning technique and the peppering technique in order to help to stimulate that relaxation effect within the muscle tissue.